First, we are grateful for our veterans. We are thankful for their service every day, but especially with Veterans Day tomorrow, we want to encourage everyone to show gratitude and appreciation to those who've served our country. Additionally, we are also grateful for our hospital partners, specifically the chief medical officers from our regional hospital systems who are joining us today for a media briefing. Today, we are joined by Dr. Frank Berline from Tenova Healthcare, Dr. Mark Brown from Covenant Health, Dr. Joe Childs from East Tennessee Children's Hospital, and Dr. Keith Gray from the University of Tennessee Medical Center. I'll turn it over to these gentlemen in just a few minutes, but first I want to begin with the local situation. We have 224 new confirmed cases since yesterday's report, giving us 14,534 confirmed cases of COVID-19 since March. Additionally, we have 766 probable cases. 13,487 of our cases are considered inactive, giving us 1,692 active cases. 504 individuals have been hospitalized at some point in their illness. 78 Knox County residents are currently hospitalized. And unfortunately, we have 2 additional deaths to report today, raising our total to 121. As a reminder, due to Veterans Day tomorrow, the Board of Health will meet virtually this evening at 5 p.m. Because of this schedule, we will also make our benchmarks available on our website today instead of tomorrow. We will review those benchmarks, as always, during our Thursday media briefing. While the benchmarks aren't posted on our website yet, I can tell you that our numbers are trending in the wrong direction. Our new cases per day are climbing, our hospitalizations are increasing, and most troublesome, so are our deaths. As we head into the holiday season, it's more important than ever to practice the 5 core actions. These actions will help you and your loved ones safe, keep you and your loved ones safe, and our hospitals from being overburdened. And with that, I'll turn it over to Dr. Gray.
Good afternoon to everyone, and Martha, thanks again for allowing us to be here. As you know, the community knows I've had the opportunity to be with you on a monthly basis for the last 6 months. But as Martha mentioned, what's different today is that we have members of all the health systems represented here, and we will all offer comments related to the impact of COVID-19 on our community and on our healthcare systems. I would like to add that Blunt Memorial Hospital has been also partnering with us and communicating with us on a weekly basis, but they are not represented here today. I really want to talk a little bit about, in the opening comments, about what's different about this update than the updates that we've given in the past, and why it's more important than ever that we all continue to work together, not only the health systems working together and working with the Knox County Health Department, but that the community continue to partner with us. I want to give you, as I've done in the past, a little bit about the numbers and the impact on our community, on our region, not just Knox County. As Martha mentioned, we've seen a sustained increase in the number of new cases really in this region over the last month or so. Compare that to what we saw in July. The amplitude of that spike was about the same, but it was narrow and the impact not long lasting. What we've seen since October is not only an increase in the number of new cases that rivals that peak that we saw in July, but it's been sustained. And as Martha alluded to, when you see a sustained increase in the number of new cases, that leads to an increase in the number of hospitalizations. We've also seen that at this point, about for every 1,000 new cases we see in our community, we have about 38 new hospitalizations. Now, while you may say that number is lower than what we've reported before, the number of new cases far exceeds what we've seen before. So the number of hospitalizations is still impactful on our communities and on our ability to take care of the people in our community. Our positivity rate of those that are being tested continues to climb. We've been sustained above 10% positivity for the last several weeks. And from a hospital systems standpoint, while we are working together, we saw a single day record yesterday of the number of hospitalized patients in the region. What else is different about our situation now in early November? The seasonality of the virus. Heretofore, we haven't had the opportunity to know what the natural history of COVID-19 is or will be during winter months. That is upon us. There's also the unknown impact of the flu virus, which is in season, and how it will compound the impact on the healthcare systems as it relates to COVID-19. We also have the Thanksgiving holiday quickly approaching, and we know that there are gatherings during the Thanksgiving holiday and the Thanksgiving weekend, but also we have kids returning home from all over the country back to our communities that further puts our community at risk of spreading the virus. After Thanksgiving, we have a holiday season that really extends through early January. Again, gatherings, shopping, again, things that put our community at risk and the impact of which is unknown at this point. And lastly, what's new is that, again, there's still uncertainty to the widespread distribution of a safe and effective vaccine. And so that's why as a group of healthcare systems, we're here today to continue to reiterate what Martha has already asked today, is that we comply and really increase our compliance with the 5 core measures. We ask for your continued partnerships in complying with those 5 core measures. And I think our goals are all the same. From a healthcare system standpoint, we want to continue to take care of every patient in this community that needs our help, whether they're infected with COVID or impacted by some other illness. We also want to continue to keep our community open and continue to operate our community. We want our kids to be able to stay in school if they choose that option. And we want to keep our first responders and our healthcare workers safe so that they continue to take care of you. And with that said, with those introductory comments over, I'll turn it over to Mark Brown for further comments.
Thanks, Keith, and thanks, Martha. I appreciate the opportunity to be here. As Keith said, I want to start off not only reiterating Keith's comments, because I think they were very well said, but saying a thank you to the community and to the partners that we have here on this call. We as a healthcare community have worked together very closely since mid-February as this pandemic has continued to spread, and have a very unique partnership, not only in the state, but I believe across the country, with how well, even though we may compete in some areas as different healthcare systems across the community, we have pulled together and come together to make certain that we can together with the health departments care for our community. So thank you to my colleagues on the call. Thanks to Dr. Buchanan, John Brinkley, Charity Menifee, and others who we literally are in communication with, Tara Sturdivant, can't forget Tara, on almost a daily basis. And I believe that has allowed us to be where we are today. Although Keith is correct, we have an increase in the number of cases, and that is a concern for all of us across the community. I believe our partnership will allow us to weather this storm if you will continue to partner with us. So thank you to you as a community. I know we're all tired. You've heard Dr. Buchanan say it before. We're all tired on this call as well. But now more than ever, as we get into some areas of uncertainty, as Dr. Gray outlined well, it is critically important that we continue with the 5 core actions that Dr. Buchanan and her team outline for us every day, every Facebook post. It truly is those actions that have allowed us to stay as consistent as we are here, and allows us and will allow us in the future to continue to care for all of your healthcare needs as a community, not just your COVID-19 needs. I do want to specifically talk about the flu, because as Dr. Gray mentioned, flu season is upon us. We have not seen a lot of flu yet in our community, and honestly, we don't know what's going to happen with the flu, but we know it is a risk for us this time of year, and it's a little bit early, but we know that this time of year puts us in a position, even without COVID, that we see an increased number of flu-related hospitalizations, an increased number of flu-related illnesses in our clinics and our urgent cares and our health departments. And it's critical more than ever, now more than ever, that we all get our flu vaccinations. So today is my commercial for everyone to get their flu vaccine. If you haven't gotten one yet, it's time to be certain that you help us prevent the spread of flu in our community. If you're older than 6 months old, you should get a flu vaccine. And I won't go into all the indications, your doctors know. So please see your physician for the recommendation of which type of flu vaccine there is for you. There is a safe vaccine for nearly everyone today. So there are very, very few reasons that anyone should not get a flu vaccine. Getting the flu vaccine will help us decrease the possibility of increase in flu-related illnesses that we normally have, that will, as Dr. Gray alluded to, really challenge our healthcare system going into January, February, even March, when we normally see greatly elevated volumes of patients with flu in all of our health systems. So today is my ask, please, if you've not yet gotten your flu vaccine, you can go on the health department's website, any of our websites, your doctor's websites, the CDC website, almost anywhere on the internet, and figure out where to get your flu vaccine. So please do that today. With that, I will turn it over to my colleague, Dr. Berline.
Thank you, Dr. Brown. I'd like to take a moment today and speak about the importance for testing. Now that the flu season has begun, many of our commercial providers of our test kits are switching over to the combination testing for flu and COVID-19. Both illnesses, as you know, are transmitted by similar mechanisms, and therefore we need to follow the core actions that Dr. Buchanan mentioned initially. This will help us to keep the flu at bay and let us concentrate more on our COVID-19 and eliminating that threat. So it is important to distinguish the flu from COVID-19, as this will help us understand which patients are more likely to become more acutely ill and which patients can be treated early with an anti-flu medication. Testing for COVID-19 has been constantly evolving. You've heard us talk about PCR testing and how it was initially available from our larger commercial laboratories and then our private molecular laboratories that existed in our region. This testing looked at the gene sequence of the virus and took a week or so to get results. Eventually, though, our commercial manufacturers began offering an antigen test. The antigen test is a bit of a quicker test, often taking only about 20 minutes, and it looks at the protein structure located on the outside of the virus itself. The PCR test remains the most sensitive method, but the antigen test provides a rapid and fairly sensitive method for testing, especially in those patients with symptoms. This antigen test is primarily what's been used for the flu in past years. More recently, though, a third test was developed that you may have heard of, and this is the antibody test. The antibody test has admittedly very little value in the acute care setting. However, it does enable us to determine those individuals that have been sick with the disease and whose body produced an immune response with the production of antibodies. It's important for us to identify those patients with antibodies to COVID-19 as they become candidates for donation of convalescent plasma. Now, a little bit about convalescent plasma. Convalescent plasma is used in those critically ill patients and has been proven to be an effective therapy, oftentimes credited with life-saving effects. The problem is that Medic Regional Blood Center, our blood provider and our provider for convalescent plasma, has had to get much of our convalescent plasma from outside the region. Those areas are now basically drying up. We need more donation locally to fill up the shelves at Medic. We're running dangerously low in our ability to provide that to our patients in the hospital setting. Medic, through its collection of blood, which also I will mention has been diminished due to the pandemic as well. But through the donation of blood, you can go in, give a unit of blood, and they will check you for the COVID-19 antibodies. If you do have the antibodies, which means that you've had the infection in the past, they will ask you if you can donate the convalescent plasma. This, of course, will be used for critical care patients in our area. So I'm asking as a final statement here is please contact Medic Regional Blood Center for additional information on how you can be a life-saving Tennessee volunteer. And with that, I'll turn it over to Dr. Childs. Thank you.
Thank you. In addition to being the Chief Medical Officer here at Children's, I'm also an ICU physician here. And it's been true throughout the pandemic that this infection with COVID-19 is not as serious in children as it is in adults. And while we have treated a number of children for the virus here in the hospital, there are not large numbers that are becoming seriously ill. So that good news is important, but we are also concerned about the pediatric patient's ability to spread the virus and how important it is to continue to take measures to prevent them from getting it and potentially spreading to more vulnerable populations. And in addition, you may have heard about what is a rare but very very serious complication from COVID-19, and that is the multi-system inflammatory syndrome, or MISC, that occurs in children. It develops after a COVID infection, sometimes after a fairly silent infection, but within a few weeks, there's a constellation of symptoms that appears that can look like other serious illness, but is actually a complication of the body's reaction to the virus, and that needs to be recognized early. And good news is it can be successfully treated when it is recognized early. We have seen that here, and it is seen throughout the country. Lastly, we get questions about, are children not only spreaders of the virus, but are they super spreaders? And the data on that is actually mixed. We have heard that perhaps they're not as likely to spread it. More recently, data suggests confusion about what's true about that. I think what's important is that we model behaviors and include our children in those behaviors for the 5 core actions to prevent spread, so that we are all doing our part to protect the community as a whole. So the social distancing, hand washing, masking, disinfecting surfaces, and then something that we're all bad at is avoiding everyone else when we're sick. I think in healthcare, sometimes we want to be heroes when we're ill and continue to work. And we have had to revisit that, and we all need to stay away when we're developing symptoms of illness. So I appreciate all the points that have been made, and I think as a healthcare community, we are proud of how we're collaborating with one another. I think this communication today is important, that we partner with you in the community to mitigate the negative effects of this virus that is increasingly present among us. So, Dr. Buchanan, I'm going to hand this back to you.
Great, and I'm going to hand it back to Kelsey for questions.
Yes, and for all of our media members that are a part of this briefing, if you can go ahead, like always, and type your questions into that chat feature. Please remember to include your name, the media outlet in which you are affiliated with, and then also if you have a question that is directed to Dr. Buchanan or one of our chief medical officers that is on this briefing, please list that in your question so we know who you are directing that question to. So the first question that we have here is from Cole with WBIR. He says, week after week, we heard KCHD give the hospital benchmark. Often they say there have been several days of red flags, but after consultation with you, their hospital partners, they list hospital capacity as yellow. At what level would the hospital move to quote red? Please be specific. And he says that question is for the chief medical officers.
And I can start that conversation. I'm sure others can join in. We, as representatives of the healthcare systems, meet on a daily basis, 5 days a week at 1 o'clock. And we look at our total capacity as a healthcare system, not just our COVID patients, but all of our capacity, as there are many other diseases that we care for on a daily basis. At this point, as Dr. Gray had alluded to, we are seeing an increasing number of cases, but our current status is still yellow. We continue to have conversations about that literally on a daily basis to be certain that we can care for all your healthcare needs as a community. Dr. Gray or others, I don't know if you have other comments.
Thanks, Dr. Brown. I just want to add that it's not only just about bed capacity. I think Dr. Brown and everyone on this call would agree that our major limitation has been staff. And so again, talking about the partnership with the community, that's why we're so adamant and in favor of the 5 core actions. Not only does it mitigate the spread of disease in the community for the community at large, but it keeps our healthcare workers safe so that we can continue to provide care related to COVID and unrelated to COVID for every member of our community. We think that if we can keep our staff members healthy, then we can continue to provide safe and effective and efficient care for the community.
All right, the next question we have is from Megan with WVLT. She asks, what factors are believed to be the biggest factor in contributing to the latest large COVID-19 spike in our region?
And I can take the first stab at this, gentlemen. So when we look at our data and we talk to cases, really what we're seeing is nothing new. We're seeing community-wide spread, social gatherings, places where people let their guard down, don't think about having to observe the 5 core actions in your friend's house or at a party with the people you're used to hanging out with. And so we're seeing cases from that. And that's really where people are just, getting tired of doing the 5 core actions, feeling silly about doing the 5 core actions at a friend's house, not wanting to offend anyone, wanting to be, considerate of others. And so we are also seeing, so the people that you work with, you become very familiar, very comfortable with them. So you have a social event with your workmates, and you're not observing those 5 core actions. So it's just a reminder to all of us, as we've all said, we can all do our part by simply doing 5 very simple things: wearing a mask, physically distancing, washing your hands, cleaning surface regularly, and most importantly, staying home if you're sick. This time of year, we always have a problem with that. There'll be events you just don't want to miss. But this year, you need to think about missing those events if you're not feeling well. I don't know if anybody wants to add anything.
Well said.
The next question we have is from Cole with WBIR. He says this question is also for hospital partners. Have you scaled back or paused elective surgeries? If so, why? If not, how are those decisions made, and at what level would you scale back these elective surgeries?
We have not scaled back elective surgeries at this point, and as I said previously, we are in communication daily to look at our capacity to care for all your healthcare needs across the community. I think the key, as I talked about in my opening remarks, is continued coordination and communication among all your healthcare leaders that you see here on this call. There's not a specific level or a target that we have set, and there won't be, because it's a moving metric as we meet all the needs of our healthcare system in the community.
One thing I'll add to that was the last time we pulled that lever in the spring, we had different circumstances. We had an unknown, we didn't know anything about the virus. We had problems with adequate PPE. We had testing capacity issues and limitations, and some of those constraints don't exist anymore. And so that's not our first go-to maneuver in times of stress. I think, as Dr. Brown has discussed already, we want to continue to collaborate and look at our overall capacity related to COVID and unrelated to COVID, and make decisions and adjustments based on that, and not let any one system be adversely affected over another system. And I think we've done a good job of that over the last 7 months.
All right, the next question we have is from Abby with WBLT. A recent Vanderbilt study published shows that counties in Tennessee with mask mandates have lower death rates. Do you feel like extending the mask mandate in Knox County is crucial?
Obviously, that's a decision the Board of Health will make in the end, but I think everybody in this call would agree with me that the mask mandate is crucial and critical to be in place and to be followed.
As we've said throughout this call, the 5 core actions are important, and they're going to continue to be for the foreseeable future. We don't know how long that's going to be. I know, as we said, we're all sort of tired of the message, but the message hasn't really changed. The things we need to do continue to be the things we need to do.
We collectively believe that masks are very important. And early in the pandemic, when masks were used to protect healthcare workers universally in hospital settings, transmission went down dramatically. So we believe that masks are important community-wide.
All right, the next
And I'll
question.
add, not just for COVID, but also for the flu, because wearing a mask will also prevent the spread of the flu, which is very important for us in this upcoming season. So I believe that what Dr. Buchanan says, yes, we're all in favor of using masks, but we don't get to make that decision.
All right, thank you. The next question, and just to do, before I do this next question, just a time update. We have just about 6 minutes or so left. So the next question we have is from Cole with WBIR. He says this question is also for the chief medical officers. We hit another record high new cases and hospitalizations today. At what point do you feel like the community needs further restrictions to stop the spread?
I would again, going back to playing this record over again, not say that we don't need new restrictions. We need increased compliance with the restrictions that already exist, the 5 core actions. I think people need to realize, again, people have heard me say it, and it's been said many times, wearing a mask or being compliant with the 5 core actions is not a political statement one way or the other. It is being concerned about yourself, one, and also your neighbor. It's being respectful of the people that may be vulnerable to this disease. While you or your loved ones or your children may not be in an at-risk population, if you're an asymptomatic carrier, you have the opportunity to prevent the spread of that unknown disease to people that are at high risk. And so out of respect for others in the community, I think there's some opportunity to increase our compliance with the 5 core actions that already exist without offering further restrictions on our community.
Next question we have is from Abby with WBLT. Have we seen any COVID-19 spread from local groups organizing political gatherings after Election Day?
We don't have any data to support that at this time.
Okay. Next question we have is from Cole with WBIR for hospital partners. Have any hospitals had to go on diversion for ambulance traffic in recent months?
I'll take that one. We manage ambulance traffic across the community and across the state and the region on an hourly basis and have for years. That's not new relative to COVID. So there are at times needs for all of us to communicate and coordinate together, working with the health department and RMCC to shift that ambulance traffic so that we can care best for the patients in our community. So that occurs frequently, but that's not a new thing. That's something that we all do and manage literally on an hour by hour basis, particularly this time of year with increased respiratory illness.
Also, another question from Cole with WBIR. This one is specifically for Dr. Childs. How many multi-system inflammatory syndrome cases has Children's treated?
We've had several that we've reported to the state as possible or probable MISC. I think we've had 2 definite ones. One that was very ill and required intensive care. So it is a rare complication, but whenever a lot of COVID-19 is around, it is something that we will see.
From Isabel with the Knox News Sentinel, how many children have been hospitalized with COVID-19?
Isabel, there have been 14 that have been COVID positive that have been in our hospital. I would say that most of those were here for other reasons and found to be COVID positive. And really only 3, I would say, were admitted because they had primary COVID disease.
All right, we're getting close to the end of this briefing. So I see there are 3 questions that are in the chat feature now. So we'll go ahead and ask these 3 questions and then we'll be done with the briefing because that'll put us right at 1 p.m. So the next question we have is from Austin with WATE. This is for hospitals. The latest numbers we have show ICU bed utilization / capacity at around 80% and 20%. What is your current ICU utilization and remaining capacity, and what levels would you like to maintain?
These levels of capacity are not uncommon for any of our healthcare systems. And as we said, we're managing those on a day-by-day basis, communicating across the system.
Next question we have is from Cole with WBIR. It says you spoke of 38 patients hospitalized per 1,000 who contract the virus. How many are you seeing die per 1,000 who test positive?
Cole, we don't have that number readily available, but I'll defer to Dr. Buchanan. But if I recall from the website, from the Knox County updates, the death rate is still less than 1%. With certain groups more adversely impacted than others. But I think that is related more to comorbidities within those certain populations than it is to their demographics or their background.
All right, and the last question we have that has been submitted is from Cole with WBIR. He says this is for hospital partners and would like each hospital partner to speak to this question. Will you be changing your Thanksgiving plans this year because of the pandemic, and how?
I'll jump in first. Well, I'm certainly going to be very thankful this year on Thanksgiving for just the ability to have all the blessings that we have, and particularly in this time of stress on all of our society. I think one of our biggest risks is congregate dining. So large groups of people around the Thanksgiving table, I think, put all of us at risk. I think that's a decision we're all going to have to make in terms of the number of folks that we do Thanksgiving with, and also the risk of those people who you do Thanksgiving with. So I think that's a decision that each person's going to have to make personally, but knowing that being exposed to people over a table for a long period of time certainly is a risky behavior for the spread of this disease.
I'll go next. Mark, happy Thanksgiving to everybody. My plans are to have a moderate-sized family gathering, and I think everybody has to assess that risk for themselves. But we've all talked among our family members that are gathering about our activities, how compliant we are with the 5 core actions, and the necessity for us to make sure that none of us are feeling ill or having any symptoms that could be suggestive of early COVID when we gather. So we're going to try to have a thankful time together. It's going to be a smallish family gathering, but certainly we hope to celebrate Thanksgiving in a meaningful way.
All right, I guess I'll go next and say, number one, I'm hoping for a continued warm phase so that maybe we can eat outside and have a little bit more social distance. But even if we do end up eating inside with my family, we will try to maybe add extra tables and spread out a bit more to maintain the social distance between ourselves. I think it's important to recall that, you know, we all have extended family, and that extended family has even more extended family. So there really is an opportunity to have some cross-infectivity across the various individuals. So I think the better thing we can do is to try to stay socially distanced, even in our own home if we can. I know that's difficult at times, but as mentioned, we need to keep those 5 cores front and center. Wash our hands, wear a mask when appropriate. And try to limit our contact with our extended families.
Now, I'll echo what these gentlemen and Martha have said. I'm going to limit we're going to limit our travel. It's just going to be my nuclear family and me gathering for Thanksgiving. I have 2 college-age kids coming from out of state that will be coming home. But I also want to end by saying, I think I speak for everyone on the call in that we would not ask the community to do anything that we aren't willing to do ourselves. I know these folks on this call, we're all compliant with the 5 core actions. And again, we're all going to demonstrate to the community that we're going to lead by example and help us navigate through the remainder of COVID-19's impact on our community.
All right, and as we stated, that was the last question. So thank you all of our media partners for being a part of this, but immensely thankful for our chief medical officers for being a part of this media briefing as well and sharing some really critical and important messages. So thank you all. We appreciate it, and we hope you have a good and safe rest of your day.
Thank you, Kelsey.